the screen at 502-912-8598. And now, because we're breaking records, unfortunately, with COVID and experiencing a volume of positive cases we've not seen before, we have to change our approach to contact tracing. And in just a moment, we'll talk more about that with Dr. Sarah Moyer, our Chief Health Strategist. So here's a little background. On June 26th of this year, so just think, that was just not too long ago here for us, we were reporting 157 confirmed cases for the week. So June 26, 157 confirmed cases for the week. Today, the weekly total is over 3,000. So this is where you see just the exponential power of these viruses. And so what happened? Obviously, we know the Delta variant is taken over by far. So you take this highly infectious Delta variant and you mix that with the reluctance of too many in our community to get vaccinated, you see this climb, almost a 20-time climb from 156 to 3,000 weekly cases. Now, communities with much lower vaccination rates than ours are seeing even worse consequences than we are here in Louisville. And our medical system here in Louisville is certainly feeling the strain. We're at about our all-time limits with the COVID cases. And if you have gone to a medical facility and had an exceptionally long wait at an immediate care facility, for instance, you know firsthand what's happening. So all these COVID cases are backing up most every other medical procedure as well. So we're not yet at capacity. A lot of that is doing big thanks to our healthcare workers, who you have to really feel bad for. I mean, number one, when we entered this virus pandemic and we didn't have adequate PPE, they fought through that. They basically worked around the clock through exhaustion to help people. Some of them got sick. And then, of course, we thought that as a community and as a country, we got behind the variant, the virus got behind us. But no, the Delta variant had other plans, and too many people didn't get vaccinated. So our healthcare workers are now getting slammed again. And this is just not fair to them or to society as well. But they are staying in there and doing their very best to keep us all healthy. Just this past weekend, we had an appreciation picnic for the Kentucky Nurses Association and just the incredible job that our nurses have done for us. Nurses, when you do these public polls, always come back as the most trusted institution in our country. And after the way they've performed throughout this virus, that those numbers are going to only go up. So again, thank you to our healthcare workers. Thank you to our nurses, administrative staff, janitorial staff, nutrition staff, everybody that's helping in our healthcare facilities. We owe a debt of gratitude to. And the best way for everybody to say thank you to them is get vaccinated, please. Okay? So I'm hopeful that we can ward off the downright terrifying situation we're seeing in other states and in some other parts of Kentucky right now, where ICUs are beyond capacity for COVID-19 patients and for anybody that has a medical emergency. And we know the right tool. So we've got some good news amongst all this is, we're having more and more people getting vaccinated, nowhere near what it was back in the heyday, but around 1,000 people a day or so are getting answers to questions that they've had and say, I'm going to get vaccinated today. So if you're in that category, please get vaccinated today. We know this is the way out of here. Some people were waiting for the FDA approval, and the FDA has applied the highest standards in the world to the Pfizer vaccine and given its approval for people 16 and older. That was last Monday. So we anticipate a similar outcome for the Moderna vaccine real soon. So there is enough evidence in with hundreds of millions of people now with these vaccines that they are safe and they are actively proving to be highly effective against serious illness and death. And our hospitals are reporting the vaccination status of their COVID-19 patients. And it's clear that vaccines are doing the job because the overwhelming number of people that are in the hospital have not been vaccinated. And those who are getting the sickest, obviously, are those without the vaccines. So the shots are free and they're available at over 100 locations in our city. And if you have any questions, please talk to your doctor or pharmacist or chat with a vaccinated loved one about their experience. The key here is not to wait. because it is truly amazing the numbers that we have with the virus right now, because so many people are protected for the most part against the virus. So it's just attacking a very small number of people in our community. The unvaccinated community here in Louisville is who is most of these numbers represent. So if you're unvaccinated, please reflect on that. The choices that you make obviously affect your own health, but the health of the people around us, the ability of our children to stay in school instead of being quarantined at home and doing remote learning. And also they affect our ability to go to work and support our families. So the ability to put this virus behind us for good is what we all want to do, but we are far from that point. You can see that with these record numbers that we have right now. And we are much further away from that than we were back in June. So that's the sad part of how we've had this setback here that was entirely controllable. But we can regain our footing, and we will regain our footing because we have the tools out there that we know work, the vaccine and the masking, and it's up to us as people to do all that so that we can get beyond this virus. So let's take a closer look at what our numbers are at today. And to do that, Dr. Moyer, our Chief Health Strategist, runs our Public Health Department, is going to provide that. Dr. Moyer.
Thanks, Mayor. So as you mentioned, unfortunately, we are setting records for COVID, but sadly, they are not records of achievement, but of people getting sick, seriously ill, and dying. And it's heartbreaking because of all of this illness and death and the stress and trauma your public health team and our healthcare heroes are experiencing is preventable. Chris, you got the dashboard up. Thank you. You can see that we are in triple red at 73 cases per 100,000. This means COVID is everywhere. It's not just community spread. We are in extra severe community spread happening. Almost 4,000 cases were added last week, just shy of a record we set in early January when the vaccine supply was limited and vaccines were just rolling out. And our testing positivity is high, meaning we are missing a lot of cases. So there are more than that 4,000 out there right now. In January, at our highest positivity rate in the community, we were at 14.39, and currently we are at 12.91. Last week, over 28,000 PCR tests were administered, so it's good that people are getting tested. Remember that anyone with symptoms, vaccinated or unvaccinated, should get tested. It may appear, you might think you just have allergies or you're just tired or have an upset stomach, but you won't know for sure unless you get tested. And you don't want to take the chance spreading the virus to other people. So please get tested for your own peace of mind and preventing the spread in our community. We've updated our website with more testing locations, and testing sites and vaccination sites are available in many locations across the community. Many have walk-in appointments available today. You can also get the test over the counter as well to do at home. But just a reminder that those at-home tests don't count if you do get positive. Encourage you to see your doctor or go to one of the regular testing sites to confirm it. Now looking at the number of deaths, we have lost 25 people to COVID just in this last week. The ages ranged from 39 to 93. That's a lot of people, but Chris, can you scroll down to the hospitalization data? Remember that these numbers update at 11 each day, so what you're seeing for today can still go up. As of yesterday, we're on a steady upward trend of hospitalizations with 337 people hospitalized, 96 in the ICU, and even more and more people every day are needing ventilators to breathe. As of yesterday, we had 70 people, patients on ventilators. And we know from past trends that about 75% of patients that need ICU care don't make it, which means that if this trend holds true 3 weeks from now, I will be here reporting not 25 deaths a week, but 70 deaths a week, almost double our peak last winter, and almost 100% of those deaths will have been preventable. But that doesn't have to be the case. You've got two choices. You can pretend you're still in lockdown still and avoid contact with people, or you can get vaccinated. So if you scroll back up to the vaccination data, thank you, Chris, you're ahead of me. You'll see here that there is some encouraging news. The number of first doses is still inching up. 60.9% of our population has received its first dose. 8.4 thousand were added last week. So thank you to 8,000 of you who made the important decision to protect our community. We are getting closer and closer to having more of our population vaccinated. 52.6% are fully vaccinated. And as we say every week, getting more people vaccinated is how we will stop the spread of the virus and save many lives from unnecessary suffering and death, keep our kids in school, and the rest of us at work. Yesterday, one county in Kentucky went back to orange, and it was the county with the highest vaccination rate. That can be us too if we can get more people vaccinated. If we look at the maps, you can see areas in our community that have higher vaccination rates than others. There is a map, if you scroll down, that shows the incident rate, where the highest number of cases are happening. Those maps are inverse. So where there's lower vaccinations, we have higher number of cases, higher number of deaths, higher number of hospitalizations. Vaccines work to prevent illness and to decrease transmission and to prevent death. I said this a lot earlier on in the pandemic, but it's worth repeating again. The virus doesn't move, people move. And remember, one person with the virus can infect 5 to 7 others, especially with Delta. And despite this being the most dangerous time in the pandemic, people are definitely moving everywhere. When we interviewed people who tested positive, they tell us they are going to parties, to funerals, weddings, concerts, church, school, work, and running errands. People are now even reporting outdoor spaces where they were 14 days before testing positive. And this includes outdoor sports games, farmers markets, Kentucky Kingdom, the state fair. And while safer, if you're still talking to someone within 6 feet when you're outside without a mask on, you can still or will give somebody COVID. So if you're unvaccinated, please stay home right now outside of essential work and school. And everyone, regardless of vaccination status, should be keeping their space, wearing a mask inside, and also outside in crowds of people. I think the last thing just to add about the data dashboard, most of the cases are in the, lost my notes, scroll down just a little bit more, in the 25 to 34 year range, although that 10 to 20 is not much lower and is inching up. So just bottom line from all this data, the Delta variant is sweeping through our population still. It will find you. So please get vaccinated today. It's time. If you're not interested, please make sure you're protecting yourself and our community by staying home. All right, I know you've got a bunch of questions for me, Mayor, so I'm going to turn it back over to you to answer those.
Okay, Dr. Moyer, so obviously that data is quite alarming. And so if you could talk a little bit about the role of contact tracing in the community, and it's obviously as quickly as this has come on and the numbers that has come at, it's now taking on a whole different role in terms of how we are implementing contact tracing. If you could explain how and why.
Yeah, so if you remember back, contact tracing is our way to try to box in the virus, figure out where it is with testing, and then isolate those people away from others so they can't spread the disease to other people. A lot's changed in the last year. We've learned a lot about COVID and how to prevent transmission and where it can spread the easiest. Per OSHA guidelines now, workplaces are required to follow CDC guidelines and keep cases and close contacts out of work. And our school systems have a year of experience as well with tackling this. Given the overwhelming case volume and the difficulty of reaching everyone now that they're out and about, we don't have the ability to reach everyone in a timely manner. A lot of times we're not even getting the reports back in a timely manner to get to people during that most infectious period during those first 3 days. So we are going to be, we've started transitioning our efforts to focus on those that are most at risk and maybe don't know what to do or need extra directions in figuring it out. So we're reworking contact tracing to optimize our resources we have and are focusing on specialty groups. This allows us to focus on the most vulnerable populations and places where there's a large number of cases and contacts so we can have the greatest impact and chance of stopping the spread of the virus. Some of these places are like helping our school systems out, daycares, factories, homeless shelters, places like corrections and long-term care. And then also talking with our patients that are hospitalized and breakthrough and reinfection cases as well to try to figure out more of the risk factors that's making those happen. This also allows us to free up time. So anyone who needs advice or has questions um, has the ability to call us to get those questions answered. So just don't forget 912-8598. It also allows us for those that need services, we're still providing essential needs. So if you need to isolate at home for 10 days and you need help with groceries or getting needs so you don't have to leave your house, we will help you with that. If you don't have a safe place to isolate in your own house away from family members, we will help you find safe housing that is away from others as well too. So we just want to free up that phone line so the people that need those resources the most are able to get through to us and we can help them out.
Okay, Doc, thank you. You want to explain the public health department's relationship with Lacuna and how that's changed, and then we'll go to Pam Wardrip with Lacuna for some more details. But if you could kind of set that up for us.
Yeah, so Lacuna is our contractor that has been helping us out over these last 18 months. They are our group of contact tracers and disease investigators and COVID experts that are answering the phone line. And they've just been a huge asset to be able to have people working from home be experts, be able to answer the call when it's needed, and they are helping us with everything. So I'm glad Pam could join us today to kind of give an overview of that and some of the common questions she's getting as well. I think it's just really important for the public to understand everything that they're doing and helping us out with here at the health department.
All right. Well, welcome Pam Waldrop with Lacuna, and you have been very busy over the last year and a half. So if you could kind of talk to us a little bit about what's going on with your team and any observations you'd like to share with us.
Sure. Well, as a disease investigator with Lacuna, I'm one of those individuals who is answering that helpline. I'm also doing case interviews, providing those resources and education, answering any questions that people may have when they find out that they test positive or have been in close contact with someone who has tested positive. The types of questions that we are getting relate to where people asking where they can get tested, where they can get vaccinated, to schedule vaccinations for those who are maybe homebound. A lot of people calling to report an exposure and getting information about what that means, being exposed to someone who has tested positive. And then when people do test positive, they call us to report that as well. And that way we're able to give them the isolation and the quarantine guidelines. We also have people calling businesses and business owners to find out what to do when, if an employee tests positive for COVID.
And have you seen kind of changes in the questions over the months that you've been running with the program?
In my experience, no, not really, just larger volume of calls.
Okay. Well, any advice for people here, Pam? You're on the front line every day.
Yes, I mean, we encourage people to call us with whatever questions that they have and if they need help. You know, throughout this pandemic, we want to help them find those testing and those vaccination sites. You know, to explain that isolation quarantine, to keep their family and to keep the community safe. And to also provide essential needs. That's a concern that people have when they're staying at home. We don't want people to feel like they have to go out, like Dr. Moyer said. So yes, call us. We can help you find those vaccination sites, those testing sites near you, and answer any questions that you may have.
Okay. And so we're open 24/7, and then we've got English as a second language assistance as well?
Yes, we do.
All right. Well, thank you for the good work that you guys are doing there. And, we're all frustrated that not everybody's vaccinated, but the good news is that we're, over 1,000 people plus are getting vaccinated every day. And as Dr. Moyer showed earlier with the chart, more people are getting vaccinated now than when we were in kind of the lowest part of it. So we just want to see those numbers double and triple, and we'll get out of this much quicker. So thank you for that service you're providing, because I know a lot of people that are getting answers from you guys are then going on to get vaccinated as well. So please give our thanks to the entire Lacuna team.
Will do. Thank you.
And
Okay, now,
Vicki, I just want to reemphasize that. I mean, they're there to answer any questions about COVID. If you need help finding a vaccine site, they can help you find the place closest to you. If you need help with transportation to get there, they can help hook you up with transportation to get vaccinated. If you're homebound and can't leave your house, they can set you up to get a vaccine in your own house. So really, they're there to help. So please make sure you're reaching out. I mean, they've got translation service in every single language. They're open 24 hours a day. So please make sure you're answering them. And then I missed a slide, so I think Chris is going to pull it up. This is one resource that Lacuna might be sending out to you. We've tried to simplify. I mean, I think you remember before it was like 14 days for something and 5 for others and 3 for others. Simplify it to just 10, 10, 10 to try to reach the most people in the simplest message. So you might see this slide when Lacuna contacts you or you contact them. If you test positive or you have any symptoms of COVID and were a close contact, you need to isolate for 10 days since the first day of your symptoms or your positive test, whichever one came first. If you test positive for COVID and have no symptoms, it's 10 days. And if you're a close contact to someone who's diagnosed with COVID, meaning you were close to them, you were in school next to them or work next to them or had dinner with them, it's 10 days from the last time you saw that person, if you saw them within 2 days of them being exposed. So that 10, 10, 10 is getting out there more. So just making sure everyone has seen that slide.
and then Doc, on there, the first 2 tens are saying isolate and the third one says quarantine. So can you explain the difference between that?
Yeah. Isolate is the term if you have COVID. So you have COVID disease or you either test positive or you have symptoms of it and test positive. So that's isolate, meaning you're not allowed to leave your house. We'll help you with groceries if you need it. So please call us. Quarantine are for people who are close contacts. So they don't yet have disease, but we're trying to keep them away from other people because it's a high chance that they might end up with disease because of exposure. And so if we keep you home away from others, we stop the chain of transmission and you don't get others sick. So quarantine is if you're not sick yet, but we think you might get sick. Isolate is if you are sick, have COVID. And that's the difference between the terms.
Perfect. Okay, thank you. Let's switch over and talk about our schools. Obviously, we all wanted to get kids back in school. We've done that so far. There's been a lot of hard work at JCPS to prepare for that. That's everybody from Dr. Polio to our teachers to the staff, bus drivers, janitorial, everybody is in. It's a huge team effort that JCPS has got back up and started here. And so we've asked Dr. Eva Stone, the manager of district health at JCPS, to join us. So Dr. Stone, welcome.
Thank you.
Boy, you must be busy.
Just a little bit, yes.
So thanks for joining us today. And can you just start by giving us a general update about what's going on with our schools?
Well, sure. As folks know, school restarted August the 11th. And so back in the spring when we came back to school, it was a hybrid model. So about 60% of our students came back to in-person learning and about half of them were there 2 days each week. Now we have all of our students back except for those just over 3,000 who enrolled in Pathfinder School. And we're dealing with a different variant, a different COVID than we saw in the spring. So overall, things are going very well. We have COVID, obviously, but our schools have just done a great job of responding quickly and helping to keep COVID out of the schools. Our mantra this year, I tell my staff over and over again, is to keep COVID out and keep students in. And I think overall, it's gone well. Our board and superintendent passed some measures to help protect our students, staff, and families, and that has been very helpful with our return to school.
Mm-hmm. Well, it's a huge endeavor. You've got, about I guess, 95,000 students now,
That's
and so
correct.
it's some
Yes.
15,000 staff or so in total. So tell us a little bit about the mitigation measures you're taking.
So there are several strategies in place in the district. First, we've worked, as Dr. Moyer mentioned, we've had a great partnership with public health, and that's very helpful. We have literally met since a year ago in July, at least once a week, often more than that. But we've had vaccination clinics. We held those prior to the start of school. We'll continue to hold those and make those available for students and staff who are 12 and above. Our, again, superintendent and board passed universal masking. So students and staff all have to wear masks when they're indoors unless they have a medical waiver on file. Schools have been asked to social distance as much as possible in the classrooms to keep at least 3 feet between students. Some schools that's more challenging than others, but they have asked to arrange their rooms and set things up so that students can be spaced as far apart as possible. One thing we're doing a little differently than we did in the spring is there's a lot more testing availability. So testing is very helpful. I like to tell people testing helps us know where we are. And I would equate it to someone with diabetes who checks their blood sugar to know where they are as far as their self-care. Testing is a little bit like that. The testing that we have available helps us to just kind of keep an idea of where we are. So we're doing screening testing that's available in every JCPS facility, and families can enroll their children to participate in that. We've got about almost 8,500 parents have enrolled their kids to take part in that. So that's really good. And we've had about 3,300 staff sign up. So there's a group that comes into every facility and does testing for people who aren't having symptoms. It just kind of gives us an idea if somebody has COVID and they may not be having symptoms, or it may be before they're having symptoms. So that helps us move them out of the congregate setting, the school setting, and the work setting so they don't infect others. Then we also, in partnership with the health department, had a grant through the Rockefeller Foundation, and that had allowed us, last year we started with the learning hubs to have drive-through testing sites available. So those are available again for families. We've just increased those, so we'll have 16 testing sites available across the city, and they're available for students, staff, and their families to have testing done if they've been exposed or they need are having symptoms or so on. Now, I will say that those are closed yesterday and today because of the weather, because you have to keep COVID tests dry in order to be able to them to be effective. So, but overall, they're now going to be open Monday through Friday from 3 to 7, and our JCPS website, people can get information about how to enroll in those. And then, of course, we put nurses in every school as part of the pandemic response, and those nurses are available to do testing for people who are on site that may be sick or having symptoms of COVID. So 3 different options for widespread testing that we've made available is a big part of our mitigation strategy. And then, of course, we've reviewed and are doing regular checks related to ventilation in the buildings. We've sent out and promoted hand washing and hand hygiene in our schools. And then a big response again, and related to the testing, is to quickly isolate those students or staff who may be having symptoms or test positive, and then quarantine those who may be exposed to COVID, and then contact tracing for those when we do have a positive case. And of course, our custodial staff, our housekeeping staff does a good job with cleaning and disinfecting. So those 9 things all together is what JCPS is implementing to help prevent, again, help keep COVID out and keep students in.
Yeah, I visited several JCPS schools already this year, and the cleanliness is really looking good. So kudos to the janitorial team for kind of setting the tone with that.
Mhm.
Tell us a little bit about the contact tracing. Are you getting good cooperation with that, and how does that typically unfold?
So yes, overall, we are getting good cooperation. And again, this was part of our partnership with the health department. They granted us last year some funds, and we're going to carry it on moving forward to implement an electronic health record. And that health record helps give us a COVID dashboard. And what that dashboard does is let each school have a report to know which students or staff are supposed to be in isolation, which are supposed to be in quarantine. And that helps us keep up with knowing when kids will be out of school and when they're cleared to return to school. So that's a big part of contact tracing. One of the things that's been a challenge with contact tracing is getting in touch with all the families by phone, especially. Sometimes people pick up, sometimes they don't. So sometimes that's been a little bit of a challenge, but we are actually going to move to a new process for notification that, number one, I think will help ensure that families get the message. Those families that may have cell phones that they lose minutes on if they answer a call, but don't lose minutes if they receive a text, I think that might be helpful. It'll allow us to get messages out in the language that people speak at home, and it'll allow us to do it more quickly, because if there are several people who are close contacts and you have to make 15, 20 phone calls, that takes a long time. And so in order to expedite the process, we want to work on that notification. So overall, it has gone very well.
Excellent. Well, we're seeing good teamwork between all members of the city here and JCPS. Thank you for your all's diligence. It's amazing what you get done with almost 100,000 kids. So just to ask everybody in the community, please do their part to keep themselves safe, but help out with JCPS as well. All right, if you can hang around for some media questions, we'd appreciate that. So let's switch over to that. So Kathy, we'll ask you to facilitate that, please.
Okay, yeah, we do have several questions in the chat. I'm going to start with some questions from Luis at La Esquina that was emailed to us. And I'm going to mix this up a little bit because I think most of these are for Dr. Moyer and one for Dr. Stone. So Dr. Moyer, why are we seeing a rise in cases?
We are seeing a rise in cases because of the Delta virus and because things are back to normal and people are interacting again. So I think just make sure people understand Delta is a form of COVID. It's just more easily transmittable. So before, instead of infecting maybe 1 or 2 people, if you're unvaccinated, now you're infecting 5 to 7 people. So it's just a much higher chance of transmitting the disease and to more people.
Okay, and thank you. I think you answered that second question. How do you know if it's COVID or the Delta variant? In the areas with the most infections, what type of work is being done?
So we are really encouraging people to get vaccinated and having many, many listening sessions, making sure they are connected to medical experts, so they can get their questions answered. And also, as you saw here, just making sure that if people choose not to get vaccinated, encourage them not to be out and about in the community, going to restaurants and concerts and church. That is how the disease is spreading.
Thank you. Clark County is going back to online learning. Have you thought about suggesting JCPS to back to online learning? Dr. Stone, would you like to answer that?
Sure. Well, there's a couple things related to online learning. First is, a school district, we can't just switch from in-person to virtual. So when schools miss days of school, it's just like snow days. We're allocated so many days of missed school. And then after that time, you have to make up the lost learning. So unless there's a legislative change that alters the number of days that school districts are allocated, it's not just a matter of switching to online learning. But the other thing I want to say is this. Louisville, one of the great things Louisville has done is come together as a community really to address this. And not all communities have done that. So I think that's a powerful testament to hear. Delta variant is one variant of COVID. There will be more variants of COVID. And so that's why the continued discussion about vaccination and the significance of vaccination is important. So to me, from a health perspective, we're getting ready. Tomorrow will be our 3rd week in school. And so what we started the school year with related to COVID, really we inherited. That's what kids came to school. We had kids that were positive. We had families that were positive. And so we needed to get a handle on where are we and then how can we slow or stop the transmission in our school buildings. Well, if we just stop and say we're going to go back to remote learning, then we're almost starting over when those kids come back, because they're going to be together with people outside of our school buildings as well. And so I think it's important for us to just understand that closing school is not the only answer to stopping the spread of COVID, because COVID was pretty rampant in the city because of the Delta variant, not even prior to the start of school. The other thing is, from a public health perspective, COVID is a significant public health issue, but so is children's success in school. And so we have a lot of at-risk children in Jefferson County who it's very crucial that they learn to read on time, that they learn to read, that they successfully complete school. And the more disruption that happens to that process, the more harm that does to them in the long run. So I think a commitment to saying we're going to do everything we can to make sure that our children have the best opportunity to learn. You know, the federal government is giving school districts a lot of resources for lost learning, for return to learning. And really the greatest thing we can do to help kids return to learning is keep them in school. And so, you know, that's why it takes all of us working together. And that's why decisions to close school need to be made with in mind the long-term outcomes for our children, and the fact that we're going to learn how to live in a world with COVID, which is what our workplaces are doing. Society has to function. And so how can we do that, and do that in the safest way possible?
I think that's a great answer. And Kathy, just want to add, I mean, research has shown that schools can be a safe place if they can follow all the preventative measures, and JCPS is amazingly operationalized all those preventative measures. And so grateful to be in a city where our students are wearing masks, they are spacing as much as possible, and they are testing. So I know Dr. Stone mentioned the testing program. I'm getting a lot of questions about it. So just want to put a plug in for that. It is funding and it's funded, it is free. And my 3 kids are signed up for it. I know they came home after the first day and were all mad because they were upset that the test that I had made them get this whole last year was painful, and the test that they had to get at school was just a little tickle. And so just know that too. It's not the back of the nose nasal swab that you may have experienced this last year. It's a little nose tickle. My 7-year-olds and 5-year-olds think it's fun. And so if you're one of the families that has been hesitant to sign up for that, please go online and fill out that form today. It is how we are going to identify COVID quickly in our classrooms, get those kids out of the classroom, make sure everyone else is safe, and that is how we're going to keep our schools open. So please make sure you fill that form up. And if you have questions, I know Dr. Stone or I can answer them.
Great, thank you. Our next question is from Sarah Ladd. Can we hear more about the EMS strike team in Louisville? How is that process working so far? Mayor, would you like to address that one?
Sure. I mean, the strike teams are just moving patients from facility to facility. It's not involved with our 911 system. It's state operated. And so it's working well as far as I know, but it shows you the kind of the volume of patients that we have, with some facilities maxing out and others having some capacity. So Dr. Moyer, I don't know if you want to add anything to that.
I don't know any specific details, just that what you mentioned, that it's, I think, part of a FEMA request that the governor had to help move patients. I mean, we're not in a great situation here, but our rural communities are even worse situations with lower vaccination rates, less hospital capacity. And so a lot of those patients are getting transferred to the Louisville area. And so being able to have that extra help to do that, I think is really beneficial.
Yeah, and I can share the Gene Porter with our communications team. She'll have more specifics on that if you need them.
Okay, thank you. This next question is from Darcy Costello. Mayor Fischer, given the city's 62% vaccination rate among Metro employees, lower among public-facing agencies such as Metro Corrections, are you considering implementing weekly mandatory testing, a vaccine mandate, and/or health insurance surcharges? If not, why not?
Oh, Darcy, a good question here. So what we've been doing over the last month or so is getting all of the data internally that you now have, so that we can see what department has what vaccination rates, and it ranges from 100% in some departments to I think as low as the mid-30s in one department, but overall average is around 62% or so. And we're trying to work with the different labor unions for them to show leadership with their folks as well. Our chiefs and directors are in conversation to make sure that that is taking place. And we just keep encouraging folks to get vaccinated, to provide them the information that they feel that they need as well. I mean, look, we're seeing around the country right now more and more mandates from the private sector, some from the public sector, are taking place as well. So right now, we're still just trying to provide information and facts so people will make a choice that's good for them and good for the customers that they come in contact with and good with their family members as well. So that's where we're at, but we're certainly aware of all the other issues that are going on here, and we're hoping that as more and more people see that, more and more people will get vaccinated. So we're evaluating all those, but are not taking a step on them right now.
Okay, thank you. This question is from Sarah Ladd. What trends are you seeing with the least vaccinated rates in the city? Are there any barriers keeping people from vaccine still, or can lower vaccinated areas be attributed to vaccine hesitancy? Where is there the most vaccine hesitancy? Dr. Moyer, you want to take a first answer?
Sure. So there is a lot of misinformation out there. A lot of people don't get their resources from their physician or from their public health department. And so we are hosting a lot of focus groups, a lot of listening sessions across the community, trying to gather data on questions and making sure they are connected to somebody that they do trust to get the answers that they need to move forward with vaccination. We're seeing the most hesitation, I think, in the zip codes that have the lowest vaccination rates. Those numbers are increasing. We had 8,000 more people get vaccinated last week, and we've seen some areas of our town move from that really light green to that medium green. So it is moving in the right direction, but just not fast enough for where we are with our current situation with COVID, but making more progress every day. And so just if anyone has any worried about cost, no, it's free. If you're worried about transportation, give us a call. We can help you out. If you can't leave your house, give us a call. We'll come to you. So just hoping as we decrease more and more barriers, the easy choice is the right choice. So that's what we're moving towards.
Okay, thank you. This question is from Mark Vanderhoff. How has the recent Kentucky Supreme Court decision, Governor Fischer versus the legislature, limited the city's tools to fight COVID? And is there anything the state or legislature can provide to help the city or give it more tools to fight COVID? Mayor, can you answer that?
Yes, our partnership with the governor had been basically we're following the mandates that he put forth with the masking in particular. Now we're fortunate in that the JCPS school board has mandated masking for our public school system, as we talked about, has over about 100,000 kids and 15,000 staff. So that's been the major area of dispute in a lot of the counties in Kentucky. So that has not been the case here in Louisville. So we're going to continue to follow the science. Hopefully the legislature will make some good decisions as it relates to COVID as well. But for the immediate term right now has not had a great impact on us, again, because of the decisions made by the school system.
Okay, thank you, Mayor. Mark had a follow-up question for Dr. Stone. As for JCPS, what flexibility or tools does JCPS need at this point from the state or the legislature? And why not go virtual temporarily like Greater Clark in Indiana?
Well, again, you know, the legislature sets the schedule for the number of days that school districts can be out of school and what has to be made up and those sorts of things. So those are legislative decisions to be made. And again, with Clark County, for the volume of people we have back in our schools, COVID transmission is not non-existent, which we'd like it to be, but it has been, the schools seem to be doing very well from, you know, what we're seeing so far, and we're tracking and monitoring that. So, moving to virtual learning moves the kids out of the school buildings, but they're moved into other settings. And so as a community, parents depend on school for work. And as I mentioned, from a public health perspective, the significance of children, the disruption to children's learning is great, and it's long term. Lots of our children eat at school. This is where they're warm, they're safe, they're cared for by adults. And so the decision to move kids out of the buildings back into other settings is one that needs to be made with great decisions, with great care, and from a public health perspective, from an infection control perspective, moving kids out just when we're getting to the point where we can manage what is in our buildings and respond quickly to COVID might actually be more harmful than it would be helpful. And so that's significant for us to remember when making those kinds of decisions.
And then, Dr. Stone, is it fair to say that they're seeing a higher rate of infection in Clark County schools than JCPS?
Mayor Fischer, I might say yes, but the truth is I spend my waking hours looking at JCPS data and how we're doing. And so I really couldn't tell you how we're doing compared to Clark County, because our focus has really been on what are our numbers telling us and how can we respond.
Okay, thank you.
Okay, thank you. I just added, Sterling Riggs had a couple of questions and he accidentally sent them just to me. He meant to send them to everyone. So I'm going to ask these two questions for Dr. Stone. Are most COVID cases in schools the result of in-school transmission or community transmission?
So it's probably a pretty decent mix of both. And the reason I say that is we get a lot of cases reported where somebody in the home has tested positive. And so kids are in isolation for COVID because of a family member or another setting where they were exposed. And we have had some in-school transmission as well. Those are the kinds of numbers that we're really starting to monitor. And I should let the public know that the JCPS website has got a dashboard, and it's got an update to the dashboard that was added at the end of last week. So we've got the dashboard that tells cumulative cases of COVID and quarantine. And then we've got now current cases of COVID and quarantine. So people can get an idea of what's currently going on in the schools.
Okay, thank you. And it looks like Chris has brought that up so everyone can see it. There was a follow-up question from Sterling for you, Dr. Stone. Do the majority of quarantine children test positive or negative? So do the majority of quarantine children test positive or negative?
So we won't have data on every child, because some parents will opt to do that follow-up test or just wait out the quarantine. They might choose not to have their child tested if they never went on to develop symptoms. And so there could be children who indeed were positive but didn't show any symptoms, and so we don't have that data. But we do watch to see, okay, if a child is exposed, how many of those cases from that exposure went on to become positive. So I don't have data that is that specific yet, because we're just in the process of being able to get all that. So I can't give a percentage to that, but that is something that we're monitoring. The bulk of our work to this point has been really working with the schools to help them with implementation of the mitigation strategies, because again, we want COVID out, we want students in. So we want to make sure that when kids are quarantined, it's because they need to be quarantined. And if we have situations where a large number of children are quarantined, then what can we do to make that better so that there's a decreased exposure? And so that's really been the focus with our initial back to school, because some of these children didn't come back to in-person learning at all last year. And so we've got people who have been teachers for a long time and we're used to teaching a certain way, and they're having to relearn how to do things. Children are having to relearn how to do things. And so we've got to get that good foundation of implementing our mitigation strategies well.
Thank you, Dr. Stone. And then we have one more question for you from Bria Jones with WFPL. She says, Dr. Stone, you said that schools are offering regular testing. How many students are signed up for the regular testing program? Why does the district believe that some students aren't signed up, and how important is it? Is the regular testing to the district's health strategy?
So we've got about 8,500 students that are signed up for the weekly COVID testing and about 3,300 employees. And again, from a health perspective, if we can get up to at least 10% of people signed up in a building, that's going to give us a good idea of COVID, what COVID is looking like in that facility. I'm very pleased with the number of parents that have chosen to participate in this program. We really weren't sure if this would be something that was parents would value and want their kids to participate in. And we've had lots of families sign up, and that's been a very powerful thing. And if you listen to the students, you'll hear them say, I have family members who are at risk, and I want to make sure that I'm not exposing my family to COVID. Sometimes I think our children are wiser than a lot of us adults, but parents have signed their children up because their children want to participate. They want to not be at school and unknowingly infecting others for COVID. So we have great participation. This is a very significant portion of our mitigation strategy because we have to know where we are to know how to respond. And the two most powerful tools we have in this fight against COVID are the vaccinations and testing. And so we need to maximize those strategies to help keep our students in school.
Thank you, Dr. Stone. And Mayor, that was the last of our questions.
All right. Well, thank you, Kathy. Thank you, Dr. Stone, for joining us here today. And thank you, Pam, as well. Everybody's doing all the hard work out there. So please, we just ask everybody in the community to do their part. Number one, get vaccinated, participate in these regular testing programs so that they can help us understand what's going on as well. It would be unwise for any of us to say, well, this is just all going to go away. I mean, what you're seeing now is we're back at peak levels that we were before we had the vaccine. So this is unnecessary, and just ask everybody that's still thinking about getting the vaccine to get your questions answered so that you can help out the community and yourself and the family by getting vaccinated. That's the way that we get to the other side of this. So with that, I ask everybody to remind us all about that, and look forward to talking to you again next Tuesday, if not before then. Thank you.